Hi, my name is Kyra McCoy. This is my video assessment for Advanced Health Assessment. First, I would start by doing hand hygiene. I would ensure safety and privacy of my patient is maintained. I would use 2 patient identifiers, so I would ask her for her name and her date of birth.
Caitlin Roth, 9/21/99.
My name is Kyra. I'm a student midwife. I'm going to perform a head, nose, and throat exam on you today. Are you comfortable in this position?
Yes.
So I'm going to start with your scalp. I'm just going to inspect it first. I'm looking for it to be round and symmetrical, which it is, so it's normal cephalic. And then I'm going to palpate your scalp. It is smooth and symmetrical all around. I'm going to move on to your temporal artery next. And then your tempomandibular joint. Please open and close, open and close. No limitations, no swelling, no issues there. So next I'm going to go ahead and move on to her face. I'm going to assess it. I'm going to look at your eyebrows, and those are symmetrical. Your parabellular fissures, your nasolabial folds, and your mouth are all symmetrical. There's no lesions, there's no swelling, there's no involuntary movements there. So next I'm going to move on to the neck. I'm going to look at it centered like this. Your head is midline, your neck is center midline. I'm going to have you put your chin to your chest. I'm going to have you roll it to the right, and then to the left, and then back up without moving your shoulders. Could you put your right ear to your right shoulder, and then left ear, and then can you extend your neck back? Perfect. All of these were smooth, controlled, no issues there. Next, I'm going to palpate your lymph nodes. There are 10 groups that I'm going to look for. I'm going to look for an extra one, which is your cervical node, which is usually seen in healthy young adults. So first, I'm going to start with the periauricular, posterior auricular, occipital, submental, subomandibular, jugulogastric, your superficial cervical, your deep cervical chain, your posterior cervical, and then I'm going to do your supraclavicular, so if you could just hunch over just a little bit. And then I'm going to look for cervical. The cervical nodes are there. All of these are soft, discrete, non-tender, movable. Overall, no abnormalities there. Next is going to be your trachea. I'm just going to look for a tracheal shift. So I'm looking at it and it appears to be midline, but I'm going to palpate just to be sure. So I would assess the whole thing and go on both sides using my index finger at the sternal notch to see where it falls. So that is normal, no swelling, and no tracheal shift there. So next I'm going to move on to your thyroid. I would have a lamp here and I would shine it to make sure there's no swelling or anything. And then I would move your neck just to kind of assess the area. To make it easier, I'm going to go behind her and I'm going to have her sit up very straight. Leans forward just a little bit and to the right. I'm going to feel the thyroid glands and assess from back here. I'm going to do both sides, kind of curving my fingers inwards to feel for that and have her swallow. So I'm going to curve this side in to get a feel and then swallow. Perfect. And then I'm going to do it again to this side and swallow. Thyroid gland goes up as she swallows and returns to resting position as she is finished. There is no limitations, no swelling, no issues there. If I were to feel that her thyroid gland was present, I would auscultate for a bruit, but I did not feel that, so I will not have to do that. I'm going to move on to your nose. So I'm going to look at it, inspect it first. It is symmetrical and proportional to your face. There are no lesions, no swelling, no drainage, no issues there. So next I'm going to take my otoscope and I'm going to assess the patency of your nasal nostrils, and I'm going to look inside of your nose. So first I'm gonna test the patency. I'm gonna do each nasal ridge one at a time and see if there's any obstruction. So I'm gonna close this side and have you breathe in. Good, and then I'm gonna have you do it again on this side. No obstruction is noted. There was also no reported, and there is no suspected nasal injuries. I'm gonna take my otoscope. I would avoid putting pressure on the septum, and I would gently have you just tilt a little bit, and I would look in both sides of her nostrils, centered like this, and then head back so I can get a different angle and look. Both sides are reddish pink in color. There's no drainage, no foreign bodies, no bleeding. There's no abnormalities. It looks good and it's moist. So next I'm going to move on to sinuses. So I'm going to assess for 2 of them. I'm going to pull up just under your eyebrows, and then I'm going to pull down. Is there any pain?
No.
Okay, so no pain present, but there was tenderness that you noted. So next I'm going to go ahead and move on to the lips. They are symmetrical to your face. They are pink. There is no lesions, no cracked. They are moist. They look really good. I'm going to go ahead and pull your lip down. And then this oral mucosa also is the same color as her lips, which is perfect, so it's pink and moist, and overall there's no damage. So I'm going to move on to your mouth and your teeth next. Could you go ahead and smile for me? And open. And then act like you're biting on something. Perfect. Teeth are white, they're clean, they're evenly spaced. There seems to be no issues with your teeth. I'm going to go ahead and look a little closer at your gums. Gums are pink, they are not bleeding, they are not swollen, they look really good there too. So next I'm going to move on to your tongue. And then I'm going to have you put it to the roof of your mouth. There are veins present, saliva is present, there is no limitations of moving. I would have gauze, and I would hold your tongue out and move it side to side to check for any white patches or lesions. I don't have that, so I'm not going to touch your tongue, but if you could stick it out and move it side to side. Perfect. No lesions, no white spots, it looks really good. Next we're going to move on to your throat. So I'm also going to have you stick your tongue out, and I'm going to assess your uvula. One more time. Uvula is pink, and it does move midline, and it goes back down when she says ah, so that's perfect. I would have a wooden stick to hold her mouth open to assess her oral mucosa better. But looking at it, it is pink. There's no swelling, no tenderness, no issues there. I think that concludes my exam. Thanks.